anyone up to the age of 18 and those on low incomes qualify for free NHS dentistry, but the rest of us have to pay. The question is, how much?
You'll only have to pay one of three prices depending on the level of your treatment. So if these charges are so straightforward, why are so many of us confused about how much we should pay? Is it because we're being taken for a ride? Many dentists offer private services alongside NHS care and will sometimes say they can only carry out certain treatments privately, which invariably costs more. For example, a scale and polish falls within Band 1 treatment, but many dentists refer their patients onto a hygienist, costing around £50 a pop.
Scale and polish, if it's a simple procedure that's more cosmetic, shouldn't be part of the NHS system. But if it's necessary on clinical grounds, then it should be offered as part of the health service.
Dentists receive money from the state based on a point system, but vastly differing levels of treatment, in terms of time and cost, accrue the same amount of points, making the system unpopular with dentists.
The UDA system is full of very perverse incentives. If, for instance, you're a dentist in an area where there's a lot of treatment demand, you might have a patient who needs a lot of restorations, a lot of gum treatment, a lot of crowns, a lot of root fillings, and you're going to be paid exactly the same for that as if you had a patient who needed only one crown. And so it's really not in the dentist's interests to take on these patients with very high treatment requirements.
As a result, some dentists use questionable tactics, known as gaming, to make up their apparent shortfalls. Practices include splitting treatments up to get more money, or even under-treating. Others choose not to offer NHS services anymore.
Our practice started with the new system in 2006 when it first came in, and we quickly found that it wasn't working for us. We found that we weren't able to offer our patients the sort of quality of treatment that they required, and so we soon stopped.
For us, the patients, it's important to be backed up in knowledge. Know what the different bands include and the prices. Remember that with any treatment received within 2 months, you won't have to pay more than the initial fee, and ask your dentist to be upfront about costs. If it won't, because you no longer have to be registered with one practice, there's nothing stopping you from going elsewhere.